NBC4, Washington's news leader. Now, live in HD, this is News 4 Midday.
The White House joins the fight against breast cancer. October, of course, is Breast Cancer Awareness Month. For one night only, the White House turned pink last night and drew some big crowds to see it. President Barack Obama made the announcement earlier in the day via Twitter. And as we said, October is Breast Cancer Awareness Month, and today we sit down with Mindy Berkson, a fertility expert, to talk about some of the options for women who are fighting breast cancer, who still want to become moms. And some of them may have already had children, some of them may be first-time hopeful moms. But you say that the options have definitely increased in the last 18 to 24 months.
Options have definitely increased, and I just want to say I am so passionate about this topic because I've helped so many women who have heard that drastic cancer diagnosis build options for treatment into their plans before and after cancer treatment. And some of these options include egg banking, freezing their own eggs so they can use after cancer treatment, maybe freezing embryos before they start treatment so that they can use those for transfer after treatment, surrogacy, egg donation. So with so many options, it is so important to be educated up front before you start cancer treatments.
Well, Mindy, let me just ask you though, when a woman gets this diagnosis of breast cancer, although it may be in the back of her mind, is there anybody there? I mean, are doctors generally there to say to them, but since you are of the age to have more children, or you haven't had children yet, here are some of your options? Or is this something that women generally have to think about themselves?
Barbara, that's an excellent question, because a recent study just showed that less than 25% of oncologists actually talk to their patients about fertility preservation options. So the onus is really on the cancer patient to empower herself with education, information, and questions, specific questions to ask her doctor so that she can increase her opportunities for possibilities before and after treatment.
Well, I'm just wondering, how much time does a person have? I'm sure that when a woman gets a breast cancer diagnosis, the very first thing she wants to do is to get rid of that cancer. So how much time does she have then to organize treatment to be able to remove eggs or to remove a fertilized egg to be saved, as you were talking about, by freezing?
Right, and that really depends on her individual situation. But the most critical question that a cancer victim can ask their doctor at that time is, how much time can I delay treatment so that I can explore fertility treatment options before I start cancer treatment? So I don't know that there's a hard, fast answer for that. I think it's very specific to each individual situation.
What are the success rates for live births for cancer patients who are in remission?
The success rates really depend on the quality of the egg or the embryo that they've preserved before or are using afterwards. Success rates always increase when we're using eggs from younger people. So if depending on the age when the woman had her eggs frozen, or if she's using an egg donor. And sometimes success rates even increase if we're using a surrogate, again, depending on individual situations and what treatments they've been through.
Well, if there are women out there listening now and they want more information on how they can handle a situation if they are cancer survivors, cancer victims, or just learning that they might have a cancer, where should they call?
Well, there's information on my website, lotusblossomconsulting.com, and also the Komen organization, komen.org, is fabulous amount of information. They've done a wonderful job raising awareness, finding resources, and helping hundreds and thousands and millions of women and their families all across the world to go through this process. And I'm just so proud and honored to be able to be a sponsor at their event honoring the promise this weekend at the Kennedy Center tomorrow evening.
That's right. That's coming up tomorrow, Saturday, at the Eisenhower Theater, and that's www.komen.org for the event that's coming up tomorrow. That's the Susan B. Komen Foundation. Nancy Brinker, of course, is so amazing what she has done in memory of her sister. Let's just tell you a little bit about that. It's celebrating 30 years of honoring the promise, as you just said, and among those being honored for her work to help find a cure for breast cancer is former First Lady Laura Bush.
Yes.
So again, Mindy, thank you so much for coming in to bring this to our attention. It's something that women should be thinking about, especially if they're facing a diagnosis.
Well, it's good to see you again, Barbara, and thank you so much for having me again.
Thanks for coming. This morning, Ben Bernanke says